smash the crushing weight of cost. How NHS charging policies endanger migrant mothers and babies. The NHS, a beacon of healthcare, casts a long shadow for some of its most vulnerable patients. A recent case highlights the devastating impact of NHS charging policies on migrant mothers and their newborns, sparking outrage and calls for urgent reform. The story of one asylum seeker, burdened with a £10,000 hospital bill after giving birth, underscores a systemic failure within a system designed to care. This mother, surviving on a meager £7 per day for all her essential needs, food, clothing, communication, and toiletries, received a bill so exorbitant it dwarfs her daily income. The paltry, healthy food supplement for mothers barely makes a dent in the mountain of debt. Her ability to repay? A single penny each month. This is not an isolated incident. It's a symptom of a broken system, one that fails to recognize the unique vulnerabilities of asylum seekers and other migrants navigating the complexities of the healthcare system. The NHS Cost Recovery Program, introduced a decade ago by a conservative government, initially targeted overseas visitors and migrants. While asylum seekers are technically exempt from these charges, the reality on the ground paints a far different picture. Maternity Action, a leading pregnancy charity, reports numerous instances of women rightfully entitled to free maternity care being wrongly billed, adding insult to injury for families already struggling to survive. The current system is not just financially crippling, it's psychologically damaging. The fear of insurmountable debt, the constant anxiety about healthcare access, and the daily struggle to provide for a newborn in the face of such overwhelming financial hardship are a toxic combination. These stresses profoundly impact the mother's mental and physical well-being, jeopardizing her recovery and the well-being of her child. The emotional toll is immeasurable, leaving lasting scars on families already dealing with the trauma of displacement and uncertainty. The case of Kim, supported by the National Childbirth Trust, NCT, is a stark reminder of the human cost of these policies. In a letter to the hospital, she eloquently articulated her plight. "I am forbidden by law from working and do not have a bank account." This statement encapsulates the inherent contradictions within the system, a system that expects payment from individuals legally prohibited from earning an income. It highlights the absurdity of a system designed to recover costs while ignoring the realities of those it affects most. This isn't just about financial responsibility, it's about human dignity and the right to health care. The NHS's mission should be to protect and care for all, regardless of immigration status or financial means. The current system actively undermines this fundamental principle. These aren't simply numbers on a spreadsheet. These are mothers and babies whose lives are being negatively impacted. They are vulnerable individuals navigating a system that should be their lifeline, yet often leaves them further marginalized and at risk. The current situation demands immediate attention and a comprehensive review of the NHS charging policies for migrants. The goal is not to eliminate all cost recovery measures, but rather to implement a fair, equitable, and compassionate system that aligns with the NHS's core values. A system that ensures that every mother and baby receives the care they need, without the crippling fear of insurmountable debt hanging over their heads. The time for action is now. The lives of vulnerable families depend on it. The current system is not only morally questionable, it is also dangerously unsustainable. We must reform it before further harm is done. The stories of Kim and countless other migrant mothers serve as a powerful call to action. Their experiences demand a response, not just a sympathetic ear, but meaningful systemic change that prioritizes the well-being of those most in need.